Good morning, everyone. I will be presenting a novel three-point suturing technique of artificial iris for bilateral simultaneous post-traumatic aniridia. I have no financial disclosures. Coming to the case presentation, a 52-year-old female had a blunt trauma to her right eye, followed by left eye in a week's time. It resulted in a massive vitreous hemorrhage with IOL and iris expulsion. Immediate vitrectomy with primary wound repair was done for both eyes. Postoperative examination revealed bilateral attached retina, aphakia, and aniridia. She had persistent complaints related to aniridia, and after 10 months of bilateral simultaneous AI implantation was planned. In view of her high myopia, IOL implantation was deferred. Her vision in right eye was 6 by 12 and in left amblyopic eye it was 6 by 18. Due to her bilateral uniridic condition, she was given a choice to select her eye color and she chose to match it with her husband. A custom-made artificial iris of desired color was ordered. Coming to the surgical technique, AI was prepared by manually refining it to 11 mm. A radial marker was used to ascertain 3 suture points at 4, 8 and 12 o'clock position. Edges of foldable AI were cut, which marks the suturing position. Also, it created a small peripheral iridectomies, which can prevent the complications like secondary glaucoma. A radial marker with tryptophan blue is used to mark the scleral spots at 4, 8 and 12 o'clock position, and corresponding partial thickness scleral flaps were made. Artificial iris was sutured with 10-0 polypropylene suture. Intraocular fixation was done with a long curved needle. It is inserted through superior limbal incision and retrieved through scleral pockets at 4 and 8 o'clock position. A folded AI was placed in a Busin glide tip, which was inserted through superior 3 mm incision. Suturing at 12 o'clock position was done with a curved needle. At follow-up, there was a successful relief to her patient's unpleasant symptoms with satisfactory cosmetic outcome. Her vision in right eye improved to 6.6 and maintained to 6 by 18 in her left eye. Anterior segment OCT showed well-centered, well-placed AI in a sulcus. Good color match was obtained with her husband's eyes. Coming to the theoretical part of artificial iris, it was developed by Human Optics in close collaboration with Professor Koch. It has certain advantages like color customization, excellent optical features, diameter of 12 mm, pupillary aperture of 3.35 mm. It is made up of a foldable material with minimal invasion. It can be used. It is a biocompatible and can be used in partial as well as total aniridia. Coming to the other techniques of aphakia and aniridia correction, artisan reconstruction IOL can be used in a partial aniridia, which is placed in anterior chamber with incision size of 5 to 8.5 mm. Gui et al. Use sutureless intrascleral fixation of AI IOL complex. It needs PC support and long corneal incision. Spitzer et al. Use 4-point transscleral Z suturing technique, which does not require flaps or knots. Presenting here with our experiences with various case scenarios. In first case, a foldable IOL was sutured to the posterior surface of AI. It was an open sky surgery with corneal transplant where 4-point suture fixation was done. In second case, the iris claw was enclaved and fixed to the posterior surface of AI. It required 6.5 mm incision and 4-point fixation. In third case, a foldable IOL was sutured and inserted through 4 mm. So coming to the unique features of our technique, this was a first report of simultaneous bilateral AI implantation in a post-traumatic case. We used a small incision approach, reducing surgical astigmatism and efficient use of Busin glide tape. We found 3-point suture fixation was safer and stable in cases with no capsular support. We used unique marking technique, which also served as a peripheral iridectomy. Thank you.
I think judges, if you have any questions for Dr. Purva Valvekar.
Is there any pre-op photograph of your patient's other eye?
I'll just.
pre-operative photograph of your patients are there? Because it's a competitive session.
So I'll share my screen.
Yeah.
So these are the pre-op photos.
Okay. Yeah. Okay, then post-op, please.
So these are the immediate post-op, and these are the at follow-up.
Okay, that your study was conducted in which part of our country?
So I did my fellowship in Italy, and it was conducted there.
Okay, in Italy. Okay,
Yes.
that was my confusion. Okay.